divine
దేహో
one.
దేవాలయ పృక్తో జీవో దేవ సనాతన.
Body is the temple, God is the indweller.
Sai everyone. My name is Dr. Ram Sivasubramaniam and I'm an ENT surgeon with the subspecialist training in rhinology, allergy and skull-base surgery. I'd like to talk to you all about a very common condition that affects the young to the elderly in Australia. It is allergy and in particular allergic rhinitis. So what is allergic rhinitis? Allergic rhinitis is a condition where allergens from the environment react in the nose, giving rise to a particular set of symptoms. These symptoms include a runny nose, a congested nose where you feel blocked in your nose, the feeling of dripping of mucus down the back of your throat, the need to sneeze often, and sometimes can be associated with features of eye symptoms known as allergic rhinoconjunctivitis, or associated with the feeling of an itchy throat or an itchy eye. It is a common condition that is prevalent in Australia, and the environmental triggers could be dust, grass, pollen, animal dander such as cat, dog or horse hair, mold, cockroaches and many more. So what are the impacts of allergy in the nose? The main issue is with regards to the nasal airway and the secondary complications resulting from obstructive sleep apnea or sleep disordered breathing, particularly in the children. As you get older, the sleep apnea becomes less of an issue, but the symptoms of allergic rhinitis significantly impacts the quality of life and the productivity of the individual. I would like to talk to you about some of the preventative measures that you can do for allergic rhinitis. So, for dust, you can do things where you can minimize carpets, soft toys around the house, and also make sure you wash your clothes in 60 degrees or above water, which kills the dust mites. For grass, it's as simple as avoiding mowing the lawn or getting outside in a windy day when there's more pollen around. So let's focus on some of the treatment options for allergic rhinitis. The commonest treatment option, and which is the simplest of them all, is the use of topical nasal steroid sprays like Nasonex that you can get from the chemist without a prescription. There are also stronger medications that you can trial, and these topical nasal steroid sprays will reduce the reactiveness of the lining of your nose to the allergic stimulants that you're getting in your nose. So they work very well when the spray gets into your nose. There's also the option of adding on antihistamine tablets or antihistamine sprays. Once again, you can get them from any chemist like Claritine, and they are aiming to stop the histamine release which happens as a result of allergy, which is also important in controlling your symptoms. If you have a positive allergen and you want to address that allergy, then the best treatment option would be immunotherapy, where the treatment is aimed at stopping your body from reacting to that particular allergen. The last option in this scenario is surgery, and the surgery is depending on how bad your symptoms are and how well you respond to the medical treatment. It can vary from a small operation to open up the nose to an operation to reduce the reactiveness in the nose called a videoneurectomy. So in summary, what I would like to mention is being able to breathe through your nose is important, because then you'll be having filtered and humidified air going into your lungs, which is far more effective than breathing through your mouth. Allergy is a very common cause for nasal obstruction and discomfort, and it is definitely worthwhile considering simple treatment options to improve the quality of life for anyone with allergic rhinitis.
కనుక వెల్త్ కంటే హెల్త్ చాలా ముఖ్యమని చూసుకోవాలి.
So here again, rather than wealth, take care of your health.
ఈ హెల్త్ దేనికోసం అంటే వచ్చిన జీవితాన్ని సార్థకంగా గావించుకునే కోసం.
And what for this health? So that you can fulfill what has been asked.